Hello and welcome everyone to our kickoff webinar for the upcoming Rural Health Summit, Trends and Disruptors in Rural Minnesota. We're glad you joined us today, and we are expecting this webinar to wrap up by 2:45. And through the webinar, our hope is to provide an opportunity for you to meet the Summit team and some of your Summit colleagues as well. We introduce you to the larger project and also how the Summit is a key element in this project. And we will provide some clarity on your role in the Summit and how you will be contributing to the success of this project. We will give you a clear guidance of how to prepare for the Summit later in June and its agenda, and how that will be taking place during Zoom as well, virtually. And lastly, provide an opportunity for you to ask any questions. The project purpose and partners. The purpose of this project, with funding from the Mayo Clinic Foundation, the National Rural Health Resource Center, and the College of St. Scholastica are partnering to conduct a study that examines the trends and disruptors within the rural healthcare environment and how these influence access to quality, affordable care in rural Minnesota. And the goals of the study are to illustrate how these interacting components of healthcare in rural communities provide a framework with the planning that we have from data and highlight and elevate rural health policy in Minnesota. So through the pieces of this project, the final one will be a report of the findings, and that will be useful for Minnesota policymakers, business leaders, communities, and healthcare providers. In our agenda for today, this is run through the project purpose and background, the actual summit purpose and design that you will all be participating in, provide an introduction to the summit packet, background materials, and next steps and questions. And we're going to start with some introductions, and Shannon's going to run us through those.
Thanks, Sally. Yeah, so thanks everybody for being here. My name is Shannon Stone, and I work with Sally and Keely and Terry here at the center. So just to get a sense of who we've got, if we could just take a couple of minutes and ask you to share your name, your title, the organization that you are joining the summit to represent, and then just the kind of an open-ended question. So what intrigues you about participating in this summit? Well, there's been a lot of communication over the past several months about this. So when you started getting some messaging about this, what was interesting about it to you? So I'll start, since I'm going to kind of go down my participant list. So I'll go first, and then I'll maybe have Terry have you go next, and then I have Joe. I think I have you under Chisholm Ambulance on my list, so I'll have you go after Terry. So my name's Shannon. I am a program specialist here at the National Rural Health Resource Center, and as we've done a lot of work preparing for this, and what intrigues me most is just I'm really excited to see all the different perspectives come together to kind of create this story about the future of healthcare in Minnesota. Terry, I'll pass it over to you.
Thank you, Shannon. I'm Terry Hill, and I'm currently the Senior Advisor for Rural Health Leadership and Quality at the center. I've been around for quite a while. We've done lots of these types of summit meetings in the past. What really intrigues me about this is that we're kind of looking beyond the next year or two, kind of into the future, and seeing how all these trends and disruptors come into play. And we're taking a very systematic approach. So I'm really big into systems, and I'm really fascinated about what's going to come out of this.
Thanks, Terry. So I'm going to hand it over to Joe, and then after Joe, I have JMHS conference. Stacey, is that you on that end? Okay, great. We'll have you introduce yourself after Joe.
Good afternoon. My name is Joe Surdich. I'm up here on West Sturgeon, just out of Chisholm, where I live. I'm the current president CEO of the Chisholm Ambulance Service. I've owned and operated the ambulance service for 37 years. So my direct interest, of course, is rural health and the importance of ambulance services being an important link in the chain for sustainability and quality care, but most importantly, access. My interest in this project goes back quite a ways. I'm a retired college president. I formed the Northeast Higher Ed District back in 1999 and was its founding president for 9 years. And during that time and even before, I was very actively involved with the Rural Community College Alliance and worked closely with the Rural Policy Research Institute, Chuck Fluharty and others, and started to see how what we do in rural is way more important than just higher education. And of course, there's kind of I guess, a nice binary mix here of both the ambulance service and just my focus on rural, especially nationally and also statewide, that just piques my interest for how we can best, as you said, look at the trends and try to eliminate as many disruptors as possible, or at least understand the disruptors.
Thanks, Joe. I'm going to have Stacey go next, and then Julie, you are next on my list.
Hi, I'm Stacey Lee. I am the CEO of Johnson Memorial Health Services. It's a very small rural healthcare system that's independent on the western border of Minnesota, almost into South Dakota. I guess my interest in this project is I always like thinking about how to apply certain things. For instance, how does Johnson Memorial, being this rural healthcare organization, fit into the overall healthcare picture of Minnesota? And even further than that, not just the rural healthcare picture, but just rural life. And if we're going to value all of our residents in Minnesota, and even broader than Minnesota, that we want to be able to provide healthcare and jobs and affordable housing. If we value those people that live in those areas and we want to continue to promote rural living, we have to figure out how to sustain rural healthcare. And that is during COVID pandemic, whether we have cases or not, and are subject to the same restrictions of those that are having tons of COVID, whether it's systems directing all of their ambulatory services into back to their areas or insurance policies. Somehow we have to fit into this big picture, and it's challenging. And so I think we need to have a voice in the overall picture of rural living today. And that's why I'm excited in any of these types of initiatives looking forward, and I appreciate the invite.
Great, thanks, Stacey. So I'm going to go to Julie in a minute, and then Brandon, you are next on my list. So Julie, would you be willing to introduce yourself?
Sure. Yeah. Can you guys hear me okay?
Yeah.
Okay, perfect. I am in between a couple meetings here, so I'm calling in. But Julie Tesh, and I am President and CEO of the Center for Rural Policy and Development. And we were created 20 years ago to research issues important to rural Minnesota that involves policy. So we actually just released a rural healthcare report. And hello, Terry. Thank you for participating in our panel yesterday. Greatly appreciated. We've gotten some really great responses, but we just released a rural healthcare report on mergers and acquisitions. And obviously very important in rural areas. And we're looking forward to doing even more research and more work on rural healthcare in this next year during our Thought Leader Survey. Actually, we are determining our next research agenda right now. We have a board meeting next week, and so I do anticipate that we will have a few rural healthcare topics in there that we will be researching. So I'm really excited to meet more people. I'm relatively new in this position, been here about a year and a half, and so just getting my roots back here in Minnesota again. I'm down by Mankato, And so just really looking forward to learning from other people and making more connections.
Great, thanks, Julie.
Thank you.
Brandon, I have you next on my list, and then Zora. We'll go to Zora for an introduction.
All right, thanks, Shannon. I'm Brandon Olsen. I'm a professor in the Computer Information Systems Department at the College of St. Scholastica and director of our Master of Science in Applied Data Analytics program. I've been part of this team here, working on the data side, doing some research on historical data, comparing county, state, and national data, and you'll see some of the results during the summit. I guess what interests me most about this summit is really to see how people's experiences either align or maybe sometimes disagree with the data that I'm finding. So I'm really interested to see what we come up with.
Thanks, Brandon. So we're going to go to Zora, and then Cap, I have you after Zora on my list. Zora, would you be willing to introduce yourself to the group?
Sure. I'm Sara Radosevich. I'm the director of the Office of Rural Health and Primary Care in the Minnesota Department of Health. And I am intrigued about learning all the things that you all are involved with, and just having an opportunity to think with other people about what some of the changes that are coming, and how do we adapt to the situation, how do we just do more with maybe less going forward. Thank you.
Thanks, Zara. We'll go to Cap next, and then Kate, I've got you after Cap. Cap, would you introduce yourself?
Thank you, Shannon. Yes, I'm Cap Wilkes with the National Rural Health Resource Center and the Director of Program Development, and also working on this team for this project to pull together the content and the design to make it a meaningful conversation and end product. I am particularly intrigued about working with the summit and recognizing the complexity of the situation, the world that we live in, and how many moving parts interact with each other to be defined as health in our rural communities, and what does that future look like. So I'm very excited about bringing folks together to talk about the complexities and see if we can sort out some of those pathways to move us into the future. Thank you.
Thanks, Cap. Kate, we'll go to you, and then I have, my list is shifting on me, so this is a fun exercise. So Kate, we'll go to you next, and then Sally, I'll have you introduce after Kate.
Well, hello, my name is Kate Johansson, and I'm the Director of State Policy and Government Engagement at Mayo Clinic. Of course, we are one of the organizations that helped catalyze this project, and I think, first of all, I'll just say thank you all for participating. We could not be more thrilled about the participants and the leaders that are being brought together and working with our partners. I'll just note that this project is being spearheaded internally at Mayo by my colleague, Randy Schubring, who's Director of Public Policy, and my boss, Piper Nieder-Sue, who is our Division Chair of Community and Government Engagement. And I know they also look forward to meeting all of you. Due to furloughs and some conflicts, we weren't all able to make this call, but I am delighted to be here. Really, what's intriguing to me most about this project is how forward-thinking it is, and that I think it represents kind of a new value proposition for the canon on rural policy and healthcare that's out there. And also, frankly, I think it's just a wonderful opportunity to let experts convene a group of some of the best minds working on these issues and try to crack this nut a little bit. And I just can't wait to be working with all of you. Thank you.
Thanks, Kate. Who did I say? Sally next? And then we'll do Sally, thanks.
Hi, Sally Buck, and I'm the Chief Executive Officer at the National Rural Health Resource Center, the nonprofit Technical Assistance Resource Center, coordinating this project. And what intrigues me about the summit is having that opportunity to bring the data, which is somewhat static and retrospective, but then also we've had this opportunity to ask the Scholastica to look forward 10 years to trend it out And then with all of you, really look at, well, what disruptors are going to impact rural Minnesota specifically differently based on different regions and different types of healthcare settings and demographics in our state, and what kinds of things can we mold to make sure we have good access and quality, affordable care.
Thanks, Sally. Summer, if you're available to speak, I see that you're, oh, there we go. So if you would introduce yourself, that would be wonderful. And then I'll have David Mark introduce himself.
Certainly. So I'm Summer Allen. I am a family medicine physician for the Mayo Clinic, and I can practice as a primary care clinician. So my interest, though, really in rural health and with the staff, as Kate shared, and our staff in the Mayo Clinic, has occurred over the past several years and centered around work. I was formerly a medical director for our patient experience, and my interest in patient experience came because I truly believe how patients engage in healthcare centers around how they experience healthcare from us. And it led to work that I've done in some of our rural practices, one in particular, our Austin Albert Lee practices around what we'd call the patient voice. And to, as many shared in the group, really trying to understand rural healthcare in the future, how we've approached it was to really understand and look at the problem differently. The initial problem we were asked to look at was how to address overutilization of the ED, which came to an access question, but again, it really then is being seen as a business problem or as an institutional problem versus as a problem of people and communities. And what we ultimately came down to is that for healthcare teams and patients is that they needed to return to a healing and supportive relationship. And so my interest in rural health is trying to support that longitudinally for people, is how do we support a healing and longitudinal relationship for them, and really incorporate in any of the work that we do the voice of people, the voice of our communities in the decisions that we make.
Wonderful. Thank you, Summer. David Mark, I'm going to ask you to introduce yourself, and then Keely, I'll have you wrap us up with your introduction.
All right, thank you everyone, and welcome. My name is David Mark. I am the department chair of the Department of Health Informatics and Information Management here at the College of St. Scholastica. I would say my first interest in this project and rural health in general is I grew up in a rural community. I've received care in a rural community as a patient, as an advocate for my children. So that's one interest, but also I think that's driven my career interest in rural healthcare and how to make better utilization of data, which is a particular focus of mine around data and the analysis of that data, and ways of supporting rural communities in making better use of their data to support organizational decisions and decisions that could impact the community.
Great, thank you, David. And Keely, would you introduce yourself one more time to the group?
Hi everyone, I'm Keely Linetto, Program Coordinator from the Center, and I'm just super excited to learn more about the different trends and disruptors that will influence rural Minnesota and hear all the different perspectives that you all bring to the table.
Thanks, Keely. Did we get everybody? Is there anybody who was missed? So you could raise your hand or just shout it out. Okay. Thanks. It's always nice to hear who's in the room, the virtual room. So thanks for taking the time to do that. We'll give you another opportunity just to, once we get together as a large group in the summit, to meet those who aren't on this call. But thanks for taking the time to do that. I'm going to turn it back over to Sally just to talk a little bit about the kind of the background and the purpose of this summit.
Thanks, Shannon. Well, we're going to kind of dive into the overall project and the different components, and then Shannon will go into the summit as well. And again, our project purpose and background, the Rural Minnesota Health Disruptor Study 2020 to 2030 is how we're titling it. And our focus question is, what are the key rural health disruptors that influence access to quality, affordable care in rural Minnesota? And we'll have this opportunity to kind of start at where we are now and then looking forward to 2030. And the project design, to answer this focus question, as we are a group that loves systems, as Terry said, is we're using a systems approach, that we're not just looking at secondary data as, you know, the one component. So we are looking at different sources of gathering data for an interconnected methodology and perspective. So we're starting with a literature review, and that has been conducted by the College of St. Scholastica. And that's identifying possible trends and disruptors to jump our thinking and design as we go into the summit. We have looked at environmental data to find information to further guide the design and inform our thinking, looking at everything from demographics and healthcare status, healthcare outcomes, facilities, industry, the economy, education. So a great scan of information, looking at how Minnesota compares to the nation or rural Minnesota, to the overall state as well. Then we also added in key informant interviews. So we talked directly with some rural community members to gain further insights on the design and build of the community profiles. So we interviewed 5 folks who are participating in the summit from their provider or leadership perspective in healthcare or behavioral health. And then we're creating some focus-based community profiles. And this is to kind of give a composite view of a region so we can better see the possible impact of disruptors across the state. Finally, then the summit is when we're bringing together all of the subject matter experts to gain the perspectives and insights. And then we'll be modeling and interpreting the findings from the summit into case studies from those 4 community profiles to understand what policy opportunities there are, and finally have a final policy paper with all of the findings and recommendations from the group. And then Terry's gonna help provide perspective of how we're kind of bringing all these components together from the system.
Yeah, thank you, Sally. This is kind of uncharted ground for us. First of all, we've done a lot of summit meetings, but this one is certainly the most extensive in terms of gathering information. The other thing I wanted to say is that as we look nationally, we haven't seen anything like this in any other states. And we've also asked for the participation of Brock Slabaugh, who's the vice president of the National Health Association, a good friend and partner of ours as well. So, it basically is going to be kind of multiple methods of gathering this information. The interaction becomes extremely important, and we'll talk a little bit about how this is going to kind of go from what had been a 2-day event where people got to know each other, and it's been pretty amazing because we've been able to reach a certain level of synergy in virtually all of the summit meetings. There's obviously been some slight disagreement, but it's amazing to me, at least, having participated in so many of these, that we reach a point in the discussion as we think about not only how we're using all this information to identify the drivers of trends. And, obviously COVID-19 has, I don't want to get ahead of ourselves here, but it's produced just some amazing sort of consequences for rural communities, rural hospitals, and rural clinics. And the question, yeah, you know, the question, we're dealing with questions on a month-by-month basis, not knowing where we may be in August, for example. But we think it's equally important to think about where are rural hospitals and clinics and rural communities going to be 3 years out, 5 years out, 10 years out. And while we have to deal with the immediate concerns and the immediate problems, we also have to be thinking from a futuristic standpoint and helping position our communities, our providers in such a way that they're going to be successful and that we're going to be able to not only maintain access to healthcare in rural America, but actually make it better in that regard. So the various pieces that Sally has talked about, we'll gather as much as that in advance of the meeting as possible. We'll come out of that meeting with your input and your discussion content. And as Sally mentioned, be able to then craft these community case studies and put a policy paper together that you will later, you know, we'll put it into writing, we'll put a draft in place, and you will have an opportunity to look at and to comment on and make sure we've got it right here as such. So that policy paper, we hope, is going to be circulated broadly. Hopefully Zora is going to be able to use it with the Office of Rural Health. Hopefully the participants will find it valuable as well. And we just think it's going to be an exciting venture, and that we're going to come out of this, particularly because we've taken this very collaborative approach with a multifaceted report, and hopefully with a really good experience for all of you. Sally, turn it back to you.
Okay. Thank you, Terry. And then we'll go into the, Shannon will talk about how we're moving through the steps of the summit and the pieces. Shannon?
Thanks, Sally. Yeah, so let's dig a little bit into the middle part of the design, the summit itself. You know, we started, as Terry mentioned, with this being an in-person meeting that was kind of spread over the course of a couple of days. And so we've been working for the last couple of months just to transition it to a hybrid format. So the idea is to have some individual time working asynchronously on your own time, and then really reserving those kind of precious hours that we have together in the summit itself for kind of reserving those for work that we really feel like needs to happen with everybody together and having some collaborative conversations. So the way that we've designed it is with a kind of some pre-summit activities that includes this webinar as part of those pre-summit activities. And then we'll be sending out a packet made up of 4 components of kind of the pre-work that we're asking you to do. We'll ask you to spend some time with it and work on it before the summit on June 24th and 25th. And I'll talk more about those pieces in a minute. Then the summit itself, as you know, is scheduled for two 2-hour meetings on from 1 to 3 on June 24th and from 8 to 10 on June 25th. And then we'll be, as Terry mentioned, asking you if you've got the time and the inclination to just give your input on some of the post-summit activity as well. So we'll ask for some time to kind of debrief with us as your time and interest permits, and give some feedback on the policy paper and some of the recommendations that come out of the summit. We don't want to be putting anything together coming out of the summit without summit participants having the chance to take a look at it and give it their blessing. So in a minute, as I said, we'll talk about those elements, kind of the elements of the pre-summit packet. But before we do that, I just want to pause and let you see who else will be participating in the summit. So here's the list of our honored participants, and you'll see some of yourselves on this list. But so you can see who is not here. We've got another running of this webinar for people to catch up on, and then for those whose schedules didn't align with this, they'll be kind of participating in this webinar recorded version. So you can see there's quite a variety of perspectives represented. We've got hospital leaders, we've got county and state health and human services directors, we've got people with a national perspective, people with a local perspective, EMS, which is wonderful to have, some smaller hospitals, some larger community hospitals. We've got people with care coordination and community development experience and policy experience. So we've got people we've worked really hard to get people from all regions of the state. So we're really excited about what all of you who have agreed to join us. We're really excited about the blend of people and the wide variety of perspectives that we'll have represented.
Excuse me, Shannon.
Yeah.
On that list, this is Cap speaking. Summer, Alan, you're on that list as well. I think that my participant list probably didn't have an X by your name quite in time for this slide presentation. So apologies for that, Summer, but you're definitely here as well. At the top, actually, with your
right at the top.
last name.
Yeah, thanks, Cap. Good catch.
Okay, thank you. Yeah, no problem. I figured it was probably just that because I had seen a list from Randy Schubring before. And
Perfect.
Again, as a practicing clinician, I will tell you the only thing, and hopefully will deliver, and generally does not conflict, the only thing that ever catches me up are deliveries. They're the one thing I haven't learned how to predict. Although in COVID era, they are trying to ask us to predict so we can get COVID testing ahead of deliveries. So I would welcome anybody who can predict when babies are born, because then I will probably have a different job. But thank you.
It would be a whole different world if we could predict when babies are going to be born. Thanks, Summer. Okay, so again, just diving a little bit into what you can expect in the pre-summit packet. So again, the intent is to let us really get any work that could be done on an individual basis, to have that scheduled kind of outside of our summit time, and then to use our time together to really dig into the material and have some good discussions. So those things that we identified as some pre-work that we thought could be done on an individual basis beforehand are here. So on June 10th, you'll be getting an email with all of these materials. And so those materials include a recording of the presentation of environmental scan data that came from our partners at the College of St. Scholastica. So you will recognize the two people on that webinar, Brandon Olsen and David Mark, who are with us today. So you'll be getting the recording of that webinar as well as just the slides themselves as an attachment. We will also be sharing with you a community profile, which I'll talk about more in a minute, and trends and disruptors document, which goes through an extensive literature review, which I'll give you more detail on in a minute as well. And then a reflection question worksheet, just as a tool to kind of help you process all of the information that we're sharing with you in this pre-work packet. So let's go through each of those in a little bit more detail. So the environmental scan review is intended to provide some context for you at the national and state level before you kind of dive into the local level through your community profile. So Brandon and David share some national and state trends describing the healthcare environment related to the topics of this summit, which are access, affordability, and quality. Gives some of the big picture data, introduces some trends and some disruptors, and shares an overview of the building blocks of the model for the future of rural healthcare that we're going to be really asking for some input from you on during the summit. So again, it kind of sets the stage and sets the context for you to dive into that trends and disruptors document as well as your community profile. So on day one, we'll be kind of digging into the local level through community profiles. And then on day two, kind of zooming back out into the broader focus of the state overall. And you'll be pulling from the information in this environmental scan on both of those days. The community profile is something that again is intended to help you dig into data and characteristics of communities on the local level. So what we've done is created what we've been calling composite communities that have been created using a compilation of data. So we chose a couple of counties across in different regions of the state that had distinguishing characteristics. So things like access to broadband or income levels or rates of or uninsured rates, whether they were particularly high for the state or particularly low. And those were chosen based on information that came out of the LIT review, plus the kind of the project team's experience with rural health across the state, as well as an analysis that was done by our College of St. Scholastica partners. So a lot of different resources went into deciding what are those characteristics that really kind of could make a community distinct from other communities in the state. And then we created a profile using a lot of different data sources. So some of those sources are specific to the counties that we identified, like county health rankings. Some of that data is specific to facilities in that actual county or in nearby counties. For example, if Hospital Compare didn't have data from a particular hospital in that community, we kind of identified one in a nearby community that we could use. And some of the data that we use covers just that region of the state. So it may not be on the county level, but it is kind of representative of that area of the state. So while we know it may be a little bit tempting to look at your profile, and each summit participant will be assigned one community profile. And we know it's going to be a little tempting to try to look at that profile and figure out who it is. The answer is that who it is doesn't really exist, because it's a little bit of a conglomeration of a lot of different characteristics, but it's still intended to be representative of a community in that area of the state and to make it distinct from other communities in the state. So what we ask you to do with this profile is just to review your assigned profile, take some time to reflect on it and kind of absorb the information that's in it, and then to use that reflection question worksheet, which I'll talk about more in a minute, as kind of a tool to pull out the things that you think are most important or most interesting about that community, so that when we come together, you're kind of ready to get with your fellow community profile group. So there'll be a hand, 3 or 4 of you will be assigned to each community profile, and you'll have time during the first day of the summit to work with your group on that particular community profile and really flesh out what's most important about it. So you'll also be getting, we've heard a lot of talk about trends and disruptors in our conversation today. So you'll also be getting a document that lays out the findings from, as I mentioned, an extensive literature review that was done by our College of St. Scholastic partners. Our Scholastica partners who aren't here are Dave Swenson and Marcella Della Torre, who did a lot of work along with Kat Wilkes in our office on this trends and disruptors document and really reviewing an extensive amount of literature. So the intention is to give us a starting point for kind of a jumping off point to help all of you as participants think about what's really going on out there as far as trends and as far as disruptors. So the things that can kind of interrupt the trends that we see. So the document itself is organized by themes, first around trends and then around disruptors. And when we started working on this project, we as a project team between the center and St. Scholastica had to do some careful definitions and decide what are we calling a trend and what are we calling a disruptor, and acknowledging that there's a little bit of overlap between the two. There's not a very clear distinction, and so we ask you not to get too stuck on, well, gosh, is this a trend or is this a disruptor? But just to kind of keep in mind the general idea of how we've been defining these. And so we've been defining trends as we've got in this slide here. So we're considering a trend to be a general direction in which something is continuing or changing, such as the aging of Americans. So we're getting older in rural areas. And a disruptor as something that can affect a trend, require a change in thinking, or change the way that we respond to something that's going on, such as one example is just a reimagined care environment. So there are a lot of different ways that we're imagining delivering care now and in the future. And so that might be considered a disruptor. So again, not a really clear line distinction between the two of them, but that's generally how we're thinking about it. So, and this document also has a reference section if you want to dig a little bit deeper into any of this. And there is the reflection worksheet. So again, as I mentioned, this is intended to be just a tool to help you process the information that's in your community profile and in the Trends and Disruptors document. So we just give you a couple of things to think about as you work through, as you kind of read through each of these. And we will never ask you to submit this or turn this into us. So this is really just a tool for you to kind of prepare yourself to have conversations when we're together on June 24th. So feel free to scribble, make it as ugly as you want, use symbols or drawings or anything that's just going to help kind of jog your memory when you get to when you come to the summit and we start to have our conversations. Before we just kind of wrap up and go on to next steps, I'm just going to throw out to the group. Does anybody have questions on the packet that you'll be getting? Okay, I will turn it over to you, Sally, to wrap us up.
Okay. Well, before I walk through the next steps, I wanted to acknowledge Brock Slaba, who joined us as well. And Brock, if you want to unmute yourself and you can unshade yourself. There is Brock. Hello.
I didn't want to interrupt by popping my video on. So.
Oh, yes, we're all learning the Zoom it again. Well, welcome. Do you want to take a moment and introduce yourself and the organization you represent? And then the question we asked everyone, Brock, is what intrigues you about participating or receiving this invite to the Rural Health Summit?
Well, first of all, thank you. And I apologize for being late. I had several things happening at once, and this one was the one that got scooted back a few minutes. Yeah, my name is Brock Slaba, Senior Vice President at the National Rural Health Association. I happen to be located in our Leawood, Kansas office. I've been with NRHA since 2008. And prior to that, I was a hospital administrator in rural Mississippi, where we had 4 rural health clinics. We were part of a networking grant project and ran a site of an area health education center for the University of Mississippi. So had quite a broad background in rural health and the realities of what it is to work in that environment. I think that just listening to the parts when I came on the line just about 15 minutes ago, one of the issues, in fact, I got a call from a hospital administrator in Missouri that was asking about disruptors and high performers in the non-healthcare space in rural America. In other words, where they've made the ability, or they had the ability to become very successful in a rural context, and then look at lessons learned from that into this. And I think that we need to start looking more intently at this topic. And then, of course, there in Minnesota, I think there's quite a bit of opportunity there in terms of where some of this has gone and where it's going. So I think that disruptors are going to be important as we look to innovation, and that's what comes out of disruption is innovation and a lot of learning. So that's what I'm interested in. I hope that hit the mark in terms of what you were expecting.
Thank you, Brock. Well, we welcome your national perspective in our discussion that is using quite a bit of Minnesota data, but I think is representative in many cases in terms of the trends and hopefully disruptors as well in terms of recommendations, so it can be used elsewhere. So our next steps, as Shannon indicated, you'll receive an email from Keely of materials on June 10th, and we encourage you to set some time before the summit on June 24th to watch a recorded environmental SCAN webinar, and Brandon Olsen from the College of St. Scholastica will be presenting the data. in terms of where we were, and as either present data or as some things like financial and information might be from 2018, but what was most recent, and then trying to look ahead and comparison Minnesota to national. And then there's the Trends and Disruptors literature review to read through, and the community profile. And we created, we said, 4 different profiles, and pre-selecting small groups of you to each get a profile, so that you'll be able to discuss that as a small group during the summit. So read through the profile, and then we have a worksheet of some prompting questions to capture your reflection from the environmental scan, the lit review, and then your profile. And you won't be asked to submit the worksheet, but to come with that ready at the summit, June 24th. So any questions?
Sally, this is Joe Surdich from Northeast Minnesota here on the Iron Range. I think I know the answer to this, but I'm still going to ask. I noticed the geography of the profiles were in the 4 quadrants of the state. So if I'm from Northeast Minnesota, would I expect to probably get assigned a community profile from that fictitious Circle Pines or whatever it was?
I'll let Shannon answer that, because I think she has a different methodology than.
That's a very good question, Joe. We are still working on our strategy for assigning. What we want, I think, what we want to make the most certain of is that we have a nice roundly represented group. So I don't know that putting people in their area of the state would be the top priority, but it would certainly be one of the considerations. I think we were waiting until we had our participant list completely finalized before we started assigning them. But if you feel very, very strongly, Joe, we would be happy to take requests.
Yeah, thank you. That's okay. I guess you confirm though that in that quadrant, the data that's feeding into it is from that region of the state, correct?
Yes. Yes.
Yeah. Okay.
Mm-hmm. Yep. Okay. Any other questions? And we will clarify, since you were on today's webinar, you do not need to attend the one on Tuesday, June 9th. We offered 2 different options. So you can do one or the other. So we thank you for your time today. We look forward to seeing you on June 24th, and then the 2 hours on June 25th as a Zoom virtual summit that we'll be doing rather than gathering in Minnesota. So thank you all for joining. Have a great day.
Thanks, everybody.
Bye.
Thank you.
Bye, everyone.
Very helpful. Thank you.
Thank you.
Thank you.